Well, today we'll just focus on grassroots governance. How do we develop from bottom up? Or perhaps the other way around, but yes, it's grassroots development. And we're joined this morning by Dr. Adetoye Alatishe, who is the Gbegande of Ososa. Thank you for coming on this morning.
Thank you very much. It's also a pleasure.
Okay, I mean, when I was looking through the designation, a little confused. Do I go with His Royal Highness? But you're a traditional ruler. And, you know, lots of people wonder, do they have professionals who take up this position?
Yeah, quite a lot. At least in Ogun State, I know of 2 other doctors. You probably know the most popular one is Dr. Adetoye Alatishe of Teju Clinic, the Oshile of Okeano, Baland. And there's one Dr. Falbenro of Okeodon, also in Yewa part of Ogun State. And I also know of myself.
So do you still practice?
Yeah, I do. Particularly I do. I like to do that very often because in the rural area, you find that there's a diet of professionals. And in my particular village, for instance, we didn't have a doctor. I made efforts to employ a doctor when I built a doctor's quarter in the health center. And there was even these citizens of Ososa who are medical doctors didn't want to come into practice. So I found myself helping out, particularly when they have serious emergencies in the maternity ward.
But have you ever faced any sort of emergency while you were on your traditional stool?
Yes,
and you had to do something?
Yes, I just told you now.
Wow.
There have been events where they had cases like retained second twin. You know what I mean? You know, like a woman delivers in a traditional home and the second twin will not come out. And you know, this thing is not just by calling the baby to come out. You have to do some maneuvers. And then they take them to the maternity center in the town. I've had calls to go and help them get the second baby out. Sometimes we have to do surgical procedures. I've had cases to when I have to get a retained placenta as well out. And so many other serious cases that nurses cannot handle.
How do your subjects take to that? Because I mean,
no, they feel good about it.
Are they comfortable with their?
Yeah, it was part of the condition. I tell you, I have my own private practice in Ijebu, which is just a few kilometers away from Ososa, but I've had to close it down and move it temporarily to a smaller place within Ososa, and I believe it has tremendously assisted the people a lot.
So now, in that case, let's talk about primary health care.
Yeah.
Let's start from there. Since you're a medical doctor, also a traditional ruler, I wanted to be clear how they pronounce that word. Is it Gbegande of Ososa. Okay.
The literal meaning is the one that carried the tallest crown. When the real Awujale that left Ijebu ages ago to go to Ososa had cause to leave the palace in Ijebu, he went into the room where the crowns were kept and took the tallest one. And so that is literally transmitted Be Ideto Gaju. So that is Gbegande.
Okay, being a doctor, I have seen what so many people have done. Now, we're talking about state governments. Right. For instance, loads of state governments have put in place facilities, equipment in different hospitals, and we've seen health centers. And now let's look at grassroots specifically. Even though some or most of them, the traditional rulers, are not medical professionals, it is very key and important that we grow our primary health care system in our localities. How have you or other others been able to carry on to make sure that this happens in their domain?
This is very important, and it was like you were there months before I actually became the Oba. I was the pioneer executive secretary of primary health in Ogun State. Invariably, I've had courses to go and give lectures to the Obas in the Oba Council in Ogun State. And I know that this is one of the things that I actually told the Obas, that you have all the right to ask professionals practicing in your villages, in your various towns. You have the right to ask them, show me your certificate, where did you graduate? This has to do with primary health, because I really pioneered quite a number of new innovations when we were there, beginning from what we just mentioned now. And this was because anybody goes to any health centers, particularly, they want to see a doctor. It is just natural. And then not really caring about who attends to your people shouldn't be, I mean, should be discouraged. So I remember going to talk to the Obas about this, and a number of them agreed that it was a good thing to do. So really in the primary health centers, which we have all over the places, Ogun State, for instance, is close to about 400. But you'll be shocked, yes. In the whole of the local government, they have about 20 to 30 doctors. And majorly they are doing administrative works. They don't have time to attend to patients in the rural area. I'm not talking of state hospitals or teaching hospitals. I'm talking of the health centers that are readily available. Most local government chairmen, I'm not going to talk about myself. When I was also council chairman, we made sure that it's always a good thing to establish health centers. But what do you do with it thereafter? Apart from putting equipment, what about personnel? You can't get doctors to work in rural areas. And this is something that the government really have to do something about. Then you now find that I haven't had all this set up. My primary concern was, how do I get a doctor to work in the health centers? And the first thing I did in Ososa was to build privately on my own a doctor's quarter. I actually employed doctors that were working there, majorly on locum, for like 2 years, and everybody was very happy. You know, the doctor, being the junior doctor, when he ran into problem, he would call me and then go consult. Presently, we don't have a doctor there because for one reason or the other, I stopped. I want the government to appreciate what we're doing. So the government himself can now say, look, we have a pilot program in Ososa. The Gbegande has employed a doctor for like 2 years. He was paying his salary. Why don't you send a doctor there? And we've been asking government to do that.
That brings me to the next question.
Yes.
You know, as to what the relationship is between yourself or between traditional rulers and local government chairmen, because you would think that primary health care should be under the purview of local governments. So how do you manage that?
Well, they're trying their best, you know. An average council chairman will tell you there is paucity of fund. I don't think Ogun State is an exception. But I think in some other states, you know, we hear of river states and some other states where the governor have really, to a large extent, assisted local government chairmen in their various programs, more particularly in the primary health centers, and I think also in Lagos State. But you can't talk about Lagos State when you're talking about rural area, because Lagos State majorly is more like a you know, urban centers. And so any doctor would be glad to work here. I had, my daughter was glad to work in Lagos when she graduated. But the fact remains that we have to continue to assist our people in the rural area. And I'm passionate about that. Very passionate about the fact that our people are just the same all over the place. They have the right to have access to professionals. Because what I have seen practically on a daily basis is terrible. A number of people leave their own people in the villages hoping that nothing will happen. And when things happen, I myself and a few other people find ourselves running around to make sure that they get medical attention. Yeah,
so you said that the local government chairmen are trying, but it doesn't seem that health is one of their priorities.
No, I don't think so. I think majorly everybody is concerned about health. What they can do about it is a different thing. You know, I mean, if you want to employ a doctor, like I just said, you know how much a doctor wants to take, regardless of wherever he is. Besides that, again, education is also important. And I think we need to also carry our people along. For instance, I regularly have meetings with traditional birth attendants. And I also let people in health industry, particularly government workers, understand that these are very vital group of people that we need to communicate with. We need to carry them along because of some of the beliefs, so that we can marry both the modern practice with the traditional medicine. Traditional medicine is very, very important in some areas, particularly in the psychiatric area. But when it comes to practical things like having a baby, where you can have, you know, I mean, sometimes pathological problems or emergencies, and not merely even malaria. People have different opinions about. If you have a rash, you just react to drugs. Some people tend to think it is measles. And you need to convince people that as an adult, you can hardly have measles. You're probably taking a drug and you're right. How can you have rashes and you're walking about? And you think it is ita, you know, it's another word for measles. So again, education is also important. And we are doing that on a regular basis. Town hall meetings, telling people that, look, if your relative is sick, the first thing is get in touch with the the doctor, and I'm always available. People call me to tell me that they have a relation that is sick. He has it. I say, okay.
Even while you're still at your traditional functions.
On a regular basis, on a daily basis. I don't shy away from that.
You know,